between connective tissue disorders like Ehlers-Danlos syndrome, which basically, essentially in a lot of these connective tissue disorders, the connective tissue, there's some sort of mutation in the gene that means that the connective tissue is not built strong enough, or there's some sort of fault in the connective tissue. And so that includes things like ligaments. So if your joints, the ligaments aren't as strong, they're more likely to dislocate or subluxate, or they come out like just a little bit and get injured. So what happens is that the body will often say, okay, well, the ligaments aren't really holding us together as well. Let's get the muscles to do that job instead. And so the muscles will kind of like, increase their tension to try and hold everything together, which often can cause pain in people. Even though their joints are hypermobile, they're stiff because their muscles are like too tight, so they're stopping them. Like they try to touch their toes and they can't because their hamstrings are so tight, right? So it's mostly the vaginismus is probably coming from that, where your pelvic floor is kind of like trying to keep the hips like more stable than usual because the ligaments aren't functioning as well. And then that causes things like vaginismus or vulvodynia pain with penetration. So there's definitely a link. And I know there's some research that shows that there are higher rates of pelvic floor dysfunction in people with Ehlers-Danlos and other connective tissue disorders. The research isn't super high quality, but it's definitely there. I think there's at least something that shows like there is something there. We're just not always sure exactly what the link is and how strong it is all the time, but it, pathophysiologically makes sense. And then I think the other part of that question, about if we know that there's like a physiological reason why this is happening, does it change the rate of success for treatment?
Correct, yeah.
I would say not really. Because honestly, diagnoses themselves, unless that diagnosis is something that we need to treat completely differently, like if it's surgical, for example, or something like that, if there's like, they have like a tear in their hip or something, and that's like a completely different treatment. Otherwise, just because they have a connective tissue disorder, we keep it in mind and we kind of say, that makes sense, and that might be the reason that this is happening. But the treatment methods don't really change. How do we reduce that tension? Pretty much it's always going to be the same. There's different tools to use, and it depends on the person which ones are going to work. So it doesn't always really help to have that diagnosis. It really is about what is happening. Does your assessment find what is causing this tension, and what treatments can we use, and testing that and seeing if that works. So I would say that the rate of success is pretty similar across people who don't have a diagnosis and people who do have a diagnosis.
Could you please speak to how being hypermobile complicates pelvic floor health? And then the Reditors asking, might I have super tight pelvic floor muscles because they are overcompensating for loose joints in the area? Well, let's start with that.
So, like we kind of spoke about earlier, like Ehlers-Danlos and hypermobile, connective tissue disorders. Absolutely. It can increase pelvic floor tension because your whole pelvic floor is trying to kind of hold on a little bit tighter to make up for the lax ligaments. And there is research that suggests there's a higher risk of pelvic floor tension and dysfunction and vaginismus with people who have been diagnosed with connective tissue disorders like that. So it definitely can. It's so hard to say if that's the thing that's causing the issue, or is it something else and you just happen to have a connective tissue disorder, which is maybe making it a little bit harder, or is it a big problem? So that's where, individual assessment is always so important, because it's, everyone is so different of how they're functioning and how their body works, that it's hard to make those blanket statements.